Yeah, so hello and welcome everyone joining from all around the world. It's a real pleasure to have you all here for this great event, Achieving Better Health for the Medically Underserved, organized by the Safe Surgery 2020 initiative with all the great partners on here. My name is Ilya Weber. I'm from Dalberg and we are part of the Safe Surgery initiative. And I'm just going to give a brief introduction to the session today with some practical remarks as well. We have a great agenda for you all, and we have some wonderful panelists looking forward to both talk about their experiences and interact with you all. As you can see from the screen right now, we are going to begin with a brief opening remarks, and then we have a bit of a panel debate where all the panelists will give some perspective on SS 2020 and how it has unfolded over the past 5 years and what is in the future. Then we will be opening up the floor for some questions and answers. I know that we also have Safe Surgery 2020 partners amongst the audience and a lot of other interesting people joining. And then we have a bit of a closing. A few practical notes here. First, I just want to run through the panel as we have it lined up today. So on the panel today, we have David Barris from the GE Foundation. We have Sherry Reynolds from Assist International. We have John Ravallo from JPIGO. We have John Mira from Harvard Medical School. We have Ching Ra from the Calmette Hospital in Cambodia. And we have Daniel Bursa, the Senior Advisor to the Minister of Health from Ethiopia. And all of these panelists are Safe Surgery partners, done different projects under the initiative and will be giving their perspectives today. Yeah, so a few practical notes. We are going to run through the agenda like this, and obviously once we open up the floor for the Q&A, that is where we hope to get the interaction with all you who are in the audience today. As you can see, there is an option to either raise your hand digitally, which we will be alerted of, or you can write a question or a comment in the Q&A section in the bottom of your screen, and that's how we want to interact with you as we go along. The first part of the session is going to be mostly the panelists speaking and David moderating the session. But then after that, we're going to open up the floor for a few questions. And then we also have a question for the audience in the middle of this session. I will leave it for a little bit later in the show to get that going. So that's it. I will now hand over to David Barris, the Executive Director for GE Foundation, the funding and foundational partner of SS 2020.
Thank you, Ilya. Hello, everyone. Thank you very much for joining us today. We really appreciate it. It's a true pleasure to be gathered here with our Safe Surgery 2020 colleagues and what looks like a pretty impressive global audience. So we really appreciate your being here. I do want to reiterate something that Ilya said, which was we hope this will be interactive and that you have lots of questions and make this a dynamic discussion. As we gather here today, we are in the midst of one of the most severe global health crises of our lives. COVID-19 has clearly, or made it painfully clear just how fragile our health systems can be when under this kind of strain. And that instability has made it particularly apparent in countries where resources are scarce and systems are a lot more tenuous. We see that now more than ever, just how important strong and resistant health systems are to safeguarding lives, especially during a crisis like this. Safe Surgery 2020's focus was not on epidemics, but now in a time of great need, as low and middle income countries continue to face the COVID-19 pandemic, we're seeing the long-term impact of our partnership's important work. Safe Surgery 2020's investments over the past few years have truly built a foundation. So today, local providers have the training and resources to pivot and take what they learned from Safe Surgery 2020 and actually address the coronavirus threat. When we began Safe Surgery 2020 initiative back in 2015, very few funders were focused on the issue of access to safe surgery. Many organizations, many folks thought that, or had a misconception that expanding access to safe surgery would be too expensive to tackle. Yet we saw the opportunity and we brought together committed partners like many of you here today to catalyze, for lack of a better term, a global action to expand access to life-saving procedures. Today, it's really critical to emphasize that continued investment in safe surgical care will provide very high value for the money committed. Studies have shown that investments in surgical care can lead to reductions in patient disability and death, and that the economic and social benefits of those reductions far outweigh the initial costs. And as you're about to hear from our panelists, we've seen this impact firsthand through our work in Safe Surgery 2020. Over the past 5 years, Safe Surgery 2020 programs have sparked change in 3 countries, in particular, Cambodia, Ethiopia, and Tanzania. And we've supported strategic plans for improvements at the national level, but we've also trained a large number, thousands of healthcare professionals and full surgical teams on the delivery of safe surgery, while also testing the effectiveness of context-specific innovations. Our work has enabled mothers facing complications in childbirth to access life-saving cesarean sections, and in turn has likely contributed to the reduction of both newborn and maternal mortality rates in those countries we've served. And as I mentioned a minute ago, in the context of COVID-19, Safe Surgery 2020's impact has been further expanded. Our partners very cleverly pivoted their programs to do things like maximize oxygen production to serve coronavirus patients, to train technicians to repair medical equipment like ventilators, and to share the knowledge they had to train frontline healthcare workers for COVID-19 through Project ECHO. These activities simply would not have been possible without the years-long commitment we made to building adaptable health systems that truly work. Most importantly, however, this work has proven that Safe Surgery's innovative model, which focuses on workforce training, infrastructure improvement, and research, can deliver scalable solutions and advance safe surgery in areas of the world that need it most. And we now know that we can expand this model to serve more countries and save more lives. But I want to emphasize, we cannot solve this challenge alone. Our programs have been impactful. However, to date, we have only touched a fraction of the 5 billion people who currently lack access to safe, affordable surgical care. We need many more partners to help deliver the more than 100 million additional surgical procedures that are needed each year. I'm hopeful that more funders and implementers will look to our model as an example and come together to bring safe surgery to those 5 billion people that still don't have access. Now it is my pleasure to introduce Dr. John Mira, a key partner, who will discuss the results of the Safe Surgery 2020 initiative, as well as what the future looks like for this important work. As mentioned earlier, John is the director of the Program of Global Surgery and Social Change, or PGSSC, at Harvard Medical School. The PGSS team has, as part of the multi-partner Safe Surgery 2020 program, was involved in our program design and its monitoring and evaluation. As well, PGSSC has published numerous papers to describe the outcomes from the program and has supported several countries in developing their national surgical plans. Thank you for being with us today, John, and I'll turn it over to you for your comments.
Thank you, David. It's great to be here, and I want to thank all of the folks who are watching today and thank our panelists and our partners. I'd like to start with this slide because I think this really gives you a flavor for the project itself in terms of all the partners. And this is somewhat indicative of what's required to deliver surgical care. So it requires an ecosystem of people to do this properly. So this is a little different than delivering immunizations. And I'm proud of what happened in terms of all these partners coming together. So originally, GE Foundation and 4 partners came together, and you can see all the people over the course of the 5 years that got involved. And our other panelists will speak more about each of these partners and how they were involved. My comments are going to be kind of at 30,000 feet in terms of giving you a flavor or an overview of the whole program. When you look at the Safe Surgery 2020 approach, there are really 4 key thematic aspects or pillars. So one is advocating for policy. 2 is strengthening workforce, so the people involved in delivering care. 3 is around innovations, so how do you test and scale innovations? And 4 is sharing. How do you share insights, information, collaboration, et cetera? So policy, workforce, innovations, and sharing and elevating ideas. Now, I wanted to show this slide to show you the, what an immense project this was. So over the course of our collaboration, we worked in 58 different health facilities in 3 countries, created 2 new oxygen plants, trained almost 3,000 healthcare employees, and have over 45 publications and contributions to the literature. And funny, this morning I woke up and we actually had submitted another one. So we're very active in getting that information out into the academic literature. When you look at Ethiopia, which was the first country in which we started, on the left side, you can look at things like outputs. So the number of surgical providers, 150. We trained 89 biomedical technicians, 631 staff. We developed the 2 oxygen plants that are helping deliver oxygen to 40 hospitals. Now, when you look at the right side and you look at outcomes, this is really rather remarkable. So in select facilities in Ethiopia, we saw tremendous improvements, 50% increase in volume of surgical services, a third reduction in mortality, 78% reduction in referrals. But the key thing that I want you to notice is in select healthcare facilities. And so that's something that we've been working on and thinking about since we've started this project. And I'm going to circle back to this because we're actually addressing what is the nature of facilities that do better in interventions like this. I just want to show you a quote here from the Ethiopian Ministry of Health. Safe Surgery 2020 has helped us strengthen our saving lives through surgery. That was their surgical strategic plan for their country. By providing expertise and additional resources, we now have strong legislation in place to elevate the importance of this issue and ensure the government's health activities are aligned. So that just shows you we were working very closely with the Ministry of Health. Now, we took what we learned in Ethiopia and then began a project in Tanzania. And based on the learnings, we said, well, number one, we really want to make sure we have very high quality evidence. So we devised a longitudinal multi-site quasi-experimental design. We said we want very high quality primary data, prospective direct observation with weekly quality checks. So we wanted to make sure that we were getting the best data. And 3, we said, how do we scale up our knowledge? And there's more than just quantitative knowledge. And we started to look more at qualitative methods. And that's going to come into some comments I make later about what makes some facilities do better than others. Again, massive, massive project. So look at some of the numbers here in terms of intervention facilities, but look at study participants, 18,000 study participants enrolled. This was a huge project, 2,700 surgeries observed. But more importantly, the outcomes. So if you look at the bottom, this was looking at the adherence of the safe surgery checklist and maternal sepsis. So at the bottom, you can see that better adherence to the safe surgery checklist was associated with lower risk of maternal sepsis. Look at that circle in the upper left-hand or the mid left-hand corner there. The green line shows that from pre to post, there was better adherence to the surgical safety checklist. In the middle, better teamwork and communication. And to the right, look at the green line. So the maternal sepsis rates went down pre to post more than in the control facilities. So there was a relationship between surgical safety checklist and maternal sepsis. And here's a wonderful quote from one of the surgical team leaders. SSC implementation has become an obligatory practice for all my surgeries. Everyone in theater understands their roles prior to surgery. That's a key statement. Everyone in the theater understands their roles prior to surgery. The SSC is an imperative tool that I can no longer leave behind for my surgeries. I think this is a major victory in a project like this. And then in Cambodia. So by the time we got to Cambodia, as I alluded to, we had more partners. And so on the left side, you can see all of the things that we deployed beginning in about February of 2019 until January of 2020. And on the right, you can see staff, and then the video conferencing. We relied much more heavily on video conferencing, even prior to coronavirus. The number of OR packages that we were involved in CPD and continual learning. And again, we looked at the surgical safety checklist, and obviously this was a much shorter project. And these are some of our early results in terms of the improvements in the surgical safety checklist usage. And then if you look at changes in behavior, so 27% improvement in appropriate antibiotic use, 21% improvement in appropriate preoperative prepping, 25% in postoperative decontamination of instruments, and then 19% increase in counts after the procedures. So you see these behavioral changes, which obviously will lead to improvements in outcomes. And here is a comment from one of the surgical providers in Cambodia. All of us have increased our knowledge and begun to play a role as leader. And I think that's a very important statement, that people are embracing the role as a leader. Each of us is skilled in something. If we work together, we can achieve something big. So that alludes to collaboration. So you have people now who are looking at themselves as leaders in a team, but also a team and involved in collaboration. And I think that's those are two critical learning points. Now, in conclusion, there are 5 things I want to summarize with. And in the upper left-hand corner, you see that safe surgery is transforming both practice and culture, but it's a journey. And this journey requires long-term partnership. To the right there, you see a multi-component intervention is the key to strengthening surgical systems, and I alluded to that earlier. This is not just delivering an immunization. This is a team sport. It requires an ecosystem. To the left, with the little spaceship there, we need to design an intervention with sustainability in mind. So we're looking towards the future. And to the right in the mid there, non-technical aspects of surgery may be the key to improving quality, culture, and organizational readiness. So, this is something that we learned along the way, that this is not just the technical aspect of delivering surgery. It's the cultural and the behavioral components that make these interventions successful. And that leads to the bottom there, where we are now in the process of developing what we're calling a safe surgery organizational readiness tool. And what we found is that some organizations are more ready than others to embark on these types of processes. And so we're just in the midst of piloting what will be a tool to help with any further interventions. Is an organization ready to embark on this, or does it need to attend to a few cultural or procedural things before it starts on one of these process improvement projects? So I think this is going to be very helpful, and I think this gets to the root of why in some of the early results we saw that some facilities did fantastically well and others didn't do quite as well. So we're hoping that this will be one of the learnings that will really help all facilities embark on these processes and be successful with these. And lastly, of course, I want to thank all our partners, and you could see all the partners in that first slide, but I really want to thank the GE Foundation specifically. I've said this many times before, that the GE Foundation made a very significant investment in global surgery, and they're one of the few, or possibly the only private sector partner who has made this kind of an investment. And I think that's really important, and I commend them for being courageous in doing that. So thank you very much, David, and I'll hand the mic back to you.
Thank you, Dr. Mehra. Thanks very much for your comments. And every time you talk about this, I'm still awed by the amount of accomplishment this partnership has had in a brief 5-year period. So it's very gratifying to see this, and thank you for sharing it. Before I go on to the next panelist, I just want to comment to the overall audience. We see some questions coming in, and we're definitely going to get to your questions, but I'd like to sort of make the rounds with the panelists first and then go to the audience for your more general questions. So with that, I'd love to introduce Dr. John Varala from Trapaigo. John is an obstetrician gynecologist with over 20 years of clinical and surgical experience in many diverse settings in over 15 countries. He's the global director of safe surgery at Trapaigo and has led the strengthening and support of surgical teams to develop leadership, surgical and mentorship skills to improve the safety and quality of surgical care. And we've been tremendously grateful for John and his team's efforts in safe surgery and leading the leadership program. So with that, Dr. Varela, I'd love to start by asking you a question of why you think investments in surgery and anesthesia care are good investments, and what you've seen from those investments over the last few years with this partnership.
Great. Thank you so much, David. It's a pleasure to be a part of this panel, and it's been an honor to be a part of the Safe Surgery 2020 initiative. And thank you for that question. It's a really good question. I think you touched upon it's in your introductory remarks, where I think that there's a misperception or a tendency to perceive that surgery is a luxury. And that it's too expensive, it's too complex for us to invest in. But what we see, is that not only is surgical and anesthesia care an indivisible or an indispensable part of healthcare, but it's affordable, it saves lives, and it promotes economic growth. And by investing in surgical care and anesthesia care, we can have a transformative impact. And what I mean by that is that by improving that access to safe surgery to the 2/3 of the world's population that doesn't have that access can be very transformative for them. And this investment can save millions of lives, save millions of others from suffering disability, as well as suffering impoverishment from catastrophic expenditure. And I think, one of the things we look at when we talk about safe surgical care, and when we say that, we include safe anesthesia, safe obstetrics, safe trauma care, that this is really a cross-cutting and cost-effective public health investment. And it enhances health, and it enhances productivity, and it enhances economic growth. And when I talk about cross-cutting, it's not in a kind of disease silo or health issue silo. So if we look at the health issues that require essential surgery, that includes maternal health, includes child health, cancer, non-communicable diseases, road and safety, road and traffic safety, and emergency services. All those benefit from that. And even looking at that, you see that the importance of surgery cuts across the life cycle continuum. So it's really is just inherent as part of, should be inherent as part of our essential services. And what we've seen, and we saw this even within the Safe Surgery 2020 program, is that by strengthening the surgical ecosystem to provide those essential emergency services, that you strengthen the entire health system, right? And by looking at, by addressing the complex problem around providing safe, timely surgical access, that you're strengthening the entire health ecosystem. So you're you're strengthening institutional capacity. And so that talks about, and you can see it with our panel, just the partnerships with ministries of health, with university and teaching institution, professional associations. We're strengthening the infrastructure. So we look at, John mentioned it, just the oxygen plant production, which is so essential. And strengthening just the infrastructure of the facilities themselves. The workforce capacity developments. And I think what John talked about, I think is really important. This is one of the things that I thought was one of the kind of key learnings from the Safe Surgery initiative, is that I think there's a lot of focus on kind of the technical aspect of surgery, which is certainly important. But it's really what we're seeing is the non-technical aspects are so important. So like Japago led on the leadership development piece. So building those leadership skills and a team-based approach to that. So improving teamwork and communication, improving the culture of patient safety, improving the culture around data quality and ownership of that data, really Yes, it improves surgical care, but it improves the entire ecosystem, the health ecosystem. So I think that's what one of the things, take homes that I had from our safe surgery interventions. And as John said, what we're seeing from our teams is that it's not affecting just the surgical teams, but this has an impact on other wards, within the facility, and you just really build this culture around patient safety and this culture around teamwork and communication. And I think that goes a long way. That has that ripple effect across technical areas and across facilities and throughout the entire ecosystem.
Great, thanks, John. I love that concept of cultural change and the ripple effect, and I think that really resonates from the very beginning of what we started here with Safe Surgery. It's a good segue then for me to actually turn to some of our in-country colleagues. And I'd like to introduce Professor Cheng Ra, who's the Director General at CalMed Hospital in Phnom Penh. CalMed Hospital has been a key partner of Safe Surgery 2020 in Cambodia together with the Ministry of Health, and has really worked hard to develop CalMed Hospital as a center of excellence for training of surgical and health staff across Cambodia. So Professor Ra, relative to what Dr. Varela just talked about, how has Safe Surgery 2020 supported improvements in surgery, but also health services overall for the people of Cambodia, particularly in Phnom Penh? And maybe even relate a little bit to it, if it's relevant, how it might have helped during COVID-19 and your response to COVID-19.
Hello, everybody. I'm very happy to join this meeting, and my impression with Safe Surgery 2020 is an important milestone for all of us concerned with improving of quality and accessibility for healthcare in Cambodia. That is very important. And we are truly delighted to be selected as the first country in the region, Southeast Asia, to run this project. And CalMed Hospital was chosen to be a training hub for playing the important role to upskill the surgical team in different provincial level hospital and other national hospital in the city of Cambodia. And also Safe Surgery supported the government to strengthen the national surgical system by providing medical essentials such as training and equipment to under-resourced hospital. And this specialist skill focus program offer long-term benefit to our surgical team nationwide. And secondly, for the question that what we are learning and began around during the COVID-19 on working with S2020 program. That is, we are emphasize that S2020 during COVID-19, they provide us a weekly continuous medical education in a variety of subjects through digital platform called ECO to enable remote mentorship and transfer the critical skill among our colleagues. And most importantly, we were succeeding in running the program called training of trainer that means our medical staff could run our own program in different provincial and national facility in Cambodia. That is very important. And that we could reskill of our specialist surgeon, and also we get the teamwork model from S2020, a complete set for our activity. Also, we could reduce, most importantly, the risk, the complication of operation in our country, especially at the provincial level. And also we could learn by organizing and by managing the operation as well, and also the leadership that we learn from S2020. And also we could reduce the death rate in our country, especially the cesarean in the maternity sector, that we have a lot of problem that nowadays we could reduce this death rate. And also for the emergency issue in the big hospital, also in the provincial hospital. And also we could achieve this in another issue is we could resolve timely, that it's not just complete but timely, on time. Thank you.
Thank you very much for your comments. It's great. I love what you talked about in terms of train the trainer. I think when we think about scaling things like this, leadership, doing some innovative things, training trainers really enables us to become something that's truly scalable. Let me turn to Dr. Daniel Bursa, who's the Senior Advisor to the Minister of Health in Ethiopia, at the Ethiopian Ministry of Health. In Ethiopia, Safe Surgery 2020 supported the Ministry of Health by helping them to build their Saving Lives Through Surgery national plan, in addition to training leadership and other support work that we did in the country. Dr. Bursa, tell me a little bit about, or tell us a little bit about how Ethiopia prioritized safe surgery, how your country developed its SALTS program, or Saving Lives Through Safe Surgery, and how did that interface a bit with Safe Surgery 2020 and what you've seen so far from the program?
So thank you, David. It is a pleasure to be here and to speak on safe surgery with this great audience. Thank you for inviting us. As you said, Ethiopia has prioritized safe surgery because of lots of reasons. The first reason is the need from the community side. As the epidemiological transition of disease is changed from communicable disease to non-communicable disease, surgical problems are is coming to be a public health problem for the community. And the other thing is from the study that the Global Lancet Commission report, in a country with more than 100 million population, we need to have at least 5 million surgeries per year. But when we launch the safe surgery strategy, we are we're doing not more than 200 surgeries per year. That means only 4% of the population are accessing surgical service. But getting surgical service is part of the human right. It's not a privilege, but it should be a human right that the government should give for the community. Especially Ethiopia is known for the primary health care service delivery system that we had. So we have learned that surgery can be done in primary health care service and can be decentralized at the local level, and can be done by integrating in the national health care service. So what we did with Safe Surgery 2020 project, we just developed a 5-year strategic plan. We call it Saving Lives Through Safe Surgery, or SAP.
I think Dr. Bursa, I think you froze here a little bit. I tell you what we'll do. I see Dr. Bursa as having frozen here. It might be a difficult connection. While we're waiting for Dr. Bursa to get back on, I'm going to actually see if any of our colleagues from Tanzania are on. I believe Dr. Sarah Mungizi may be on, and I want to give her an opportunity also to comment on what she's seen so far from Tanzania and the work that we've done with Safe Surgery. So Dr. Sarah, if you're on and available, we'd love to hear your comments and your thoughts about the impact of Safe Surgery in Tanzania while we're waiting for Dr. Bursa to get his connection back.
Sorry for the poor internet connection. Yes.
There you are.
So the leader.
Daniel, maybe if you turn your video off, your connection will be a little bit more stable.
And all those other important pillar from the safe surgery is like building infrastructure for our operational room in health centers. So we are just trying to construct around 410 OR blocks in health center, in primary healthcare unit, where it's very near to the community, which are in need of essential and emergency service like cesarean section and acute abdomen. And we tried to scale up the training program, the residency program. And immediately after we launched this initiative, we managed to enroll more than 350 surgeons and gynecologists in universities. This is also a breakthrough because previously we do have like nearly the uptake was less than 50. And the other important part is the innovation component. And we are very much glad to have 2 oxygen plants. And now, currently, I can say that the most successful public-private ship oxygen plant in the country are these 2 oxygen plants that's built in the support of this project. And we are glad that we are just developing a feasibility study to establish around 10 oxygen plants in the countries by seeing this as an example. And the federal government is also wants to invest on that. That's also a great news. And this also helped us just to combat the response for COVID-19 oxygen needs. And we took this as an example to convince the higher officials in the Ministry of Finance. And the other important part is the M&D component. I remember when the Harvard team came to Ethiopia, they wanted to have like the M&D tool for just measuring only the project. But we have discussed with the team, the project team, and agreed that to have like a national M&D framework and tool. Now, currently, we have like institutionalized the M&D framework to the national system. So we are glad to have that. The routine M&D systems capture important surgical intervention, and we are glad that we have a lot of publications with the surgery, with the Safe Surgery 2020 team and also colleagues. And the other part is partnership, especially partnership with stakeholders like Ethiopian Surgical Society, Ethiopian Anesthesiology Society, and other important stakeholders were part of this process. And now the academia is also part of the policy formulation process as far as surgery is concerned. And the other is on the quality piece. We have tried to implement safe surgery implementation. Now the surgical site infection is decreasing, and also the quality of service that we are giving is improving. So all of this, the lesson from all of these initiatives that the first one is surgery can be done in resource-low countries like us with primary healthcare service. And the other is if we don't have surgical service, we can't tell health coverage. So what we do is package surgery is part of the health system, the Ministry of Health and the regional government responsibility. So thank you for the project. The project, catalyze, support the government ambition, mission to scale up surgical service in Ethiopia with a population of 100 million. I can say almost you are supporting 10% of the African population, because we are 10% of the African population. It's a huge impact, and I'm glad that other countries are learning from us. So thank you, David.
Thank you, Daniel. I'm glad to say, I love that perspective on 10% of the African population. John, I saw your hand go up. You wanted to say something?
I just wanted to congratulate Daniel in Ethiopia, because he so calmly just mentioned that Ethiopia now has a national M&E plan for surgery with, I think, 15 or 18 KPIs that they track. That is just a remarkable accomplishment, that they would at a national level say, okay, we're going to track these things every year. I don't think that can be overemphasized, and that's exactly where countries need to get to, and I just cannot congratulate them enough for doing that.
That's a great comment, John. Thanks for raising your hand and emphasizing that. I appreciate that. A minute ago, while Dr. Bursa had a challenge with his connection, I offered Dr. Sarah Mangizi from Tanzania the opportunity to make a comment. So, Dr. Sarah, if you are on the line and can unmute, we'd love to hear your perspective briefly about the experience in Tanzania as well.
Thank you very much, David. Sorry, because I have a bit of a flu, so you'll excuse my voice. But can you hear me?
Yes, we hear you well. Thank you.
Yeah, thank you very much. So Tanzania embarked in the safe surgery initiatives way back in 2019. And we decided to do this because, as you know, that we have at least 19% of the deaths in Tanzania are attributed to disease that can be addressed by surgical and obstetric care. And according to the World Development Indicators, our surgical volume is very low, which is about 484, of which WHO recommends 5,000. And we have very low, very minimal specialists, which is only 0.46 per 100,000. So in a population of about 66 million in Tanzania, and with these numbers, we thought that we should embark in this endeavor. And we thank the GE Foundation for the support. We started by developing our NSOP with the help of GE Foundation, Assist International, and all the partners in safe surgery. And we are happy to say that the plan is doable because it was written by frontline providers to reflect their needs. It didn't come from the Ministry of Health, even though we were just advising. And the good thing is it was launched beside the extra-ministerial meeting. And I'm very proud to say that in terms of internationally, our plan got a very big support, and some of these countries came to learn from us. So what did we do from there? After the launching, we got support from, again, from GE Foundation through Assist International. Thank you very much, Sherry Reynolds. Unfortunately, COVID-19 came in, but fortunately enough, in Tanzania, we continued working. It's about only few activities which were not implemented. There were things like meeting with development partners to advocate for our plan so that they can put budget. But in Tanzania, we went to advocate our plan to the local government authorities. We have a system nowadays. The funding goes straight to the facilities. It's called direct health facility financing. So if you talk to the lower facilities and they understand about your plan, it's more likely to be for them to plan in their budget. So we started with the local government authorities, but we also advocated to the ministry itself, so that we play around the budgeting at the ministry level and budgeting at the local government level. We are happy that we had a meeting, the technical working group meeting, to define our indicators, so that, and we incorporated the monitoring and evaluation department of the ministry, so that the indicators can be collected and they can be translated in our HMIS, the health management system in the ministry. And we collaborated with one of the partners in Tanzania, Japaigo, and another partner who is working at Kilimanjaro, who is South Africa. And we, because they were using two different tools, the South Africa is using another type of tool, and Japaigo, who piloted the safe surgery activities in Lake Zone, they were using another tool. So we try to harmonize that. And thank you very much, Cheryl. I can assure you, Q2 activities are going to finalize the tools. We're going to pilot these tools, and eventually we are going to incorporate them to our DHIS, so that come next year, we are going to collect these data at the ministry level. Another milestone which we are going to achieve, we are going to have an NCD week. It's a program which was launched last year. So this year we are going to commemorate NCD week, that will be on the 7th to 14th. So we have sent an abstract to present it in NSOP. We're going to have a lot of people there, at least 500 to 1,000 people. So at least if we're going to present our NSOP there, I'm sure it will be taken. But secondly, we are going to present it there's another meeting, surgical meeting in Kilimanjaro on the 18th to 20th of November. We have also sent an abstract, and we are collaborating with Shenaz because she could not come, so that we can present some of the findings which were collected in Lake Zone. So in short, this is just in a nutshell. We have passion with surgical services. And I think at this moment, most of the people understand what the plan is, and they are ready to support the plan. And thank you very much, Safe Surgery 2020. Thank you, David Baraj. Thank you, Cheryl. And thank you, John Mara, for the support you're giving to Tanzania. Thank you very much.
Sarah, thank you so much for your comments. I really appreciate it. I appreciate your bringing up the idea of financing and budgets and how important that is to planning. I'd love to, there have been a couple of questions in the audience, and I'm going to go, I think there was a raised hand earlier on in the conversation from Rebecca. So if you're still there and have a question, Rebecca, unmute and ask us your question or make your comment. Okay, maybe you're dropped off here. There was a question here from Mark, and the question really is, can Dr. Varallo talk a little bit more about the time it took to get culture shift to happen and what you need to do to break down a hierarchy that is often present in many surgical and country environments. So maybe John Varallo, you talk about that a little bit, and then any of the other panelists who want to comment on that as well would be helpful.
Great. Thank you, Mark, for that question. And I think it goes back to those, we were talking about the importance of those, the non-technical aspects. And our approach that we did, that Japaigo takes with the leadership is really a collective leadership approach. And so rather than focusing on, say, just the surgical provider or the anesthesia provider, we take the entire surgical team. And by team, we're talking about the surgical provider, anesthesia provider, the circulating nurse, ward nurse, and midwife. And they're part of a team that attends that leadership approach. And I think that's really important because we know that in the operating theater, professional hierarchies, those entrenched professional hierarchies can be barriers to effective teamwork and communication. And so when we're talking about the workforce development, we focus on those leadership qualities mentorship and the clinical skills, but as a team. And what we've seen is, and it's difficult to put like a time frame on it, and I know it's a good question, but I think there's, we see this kind of run the gamut where you have early adopters, and those are really kind of your leaders, and John had alluded to it for those kind of high performing facilities or high performing teams and lower performing teams. But I think what we've seen, what is critically important, is that collective leadership approach, and teaching those skills around teamwork, communication, patient safety skills, and importantly, the use of data. I think really drives the program forward and really makes the team much more responsive. And this is also kind of helps us. It really helped us pivot during the COVID pandemic, and just building on, as with assist with the Project Echo platform, being able to pivot to that virtual mentorship was really critical, and having that kind of leadership, so teams that were able to identify problems and creative problem solving was really essential for that effective pivot. Great.
Thank you, John. Thanks for that answer. It was very helpful, and a great question from Mark. I appreciate it. With that, I'm going to turn to our final panelist, Sherry Reynolds, who's going to talk a little bit about our next steps. Sherry is the Director of Global Health and Program Development, leading the Innovation Pillar for Safe Surgery 2020 on behalf of Assist International. Assist International has been a longtime partner of the GE Foundation and drives new solutions for top priority surgical gaps in resource-poor countries. They are true innovators. They've been innovative in funding, training, mentorship, and really provided a lot of the needed infrastructure with infrastructure upgrades, equipment upgrades, and have managed our equipment donations for many, many years. So with that, I'd love to turn to you, Sherry, for the path forward, next steps, and how we continue the advancement of global safe surgery.
Thank you, David. And what a privilege and honor it's been to be a part of Safe Surgery 2020, and just seeing all the panelists and participants. It makes me miss that we're not all together in person. I really wish that we were. But as we're coming to the close of Safe Surgery 2020, it is important for us to look forward and to say, where do we go from here? And I think the first question that we have to ask ourselves is, we have to ask, is safe surgery a cause worth investing in? And for us as partners, for our colleagues on the ground, I think that we would definitely say that it's a resounding yes. And the reason for that is because investing in safe surgery, as we've heard woven throughout the talk today, it's an investment in health system strengthening. And the investment multiplies. It helps more than just the surgical patient. It helps more than just the operating theater. And the reason that that is the case is because, in part, you have to invest in all of the 4 S's. You have to invest in staff and stuff and space and systems. And we did that through our Safe Surgery program, and really had this year, through the global pandemic, was able to see how much of an impact that we were able to have that went beyond the OR theater. I could talk about every single program that we've done and how the pivots were made to be able to help the health system deal with the pandemic, but just to highlight a few. First, we invested a lot with anesthesia providers, and let me just say, you cannot have safe surgery without safe anesthesia. It's critical and it's important. And through dealing with and capacitating anesthesia providers, they were prepared to run the ICUs and to intubate and to work with the ventilation that was needed for COVID-19 patients who were critically ill. Access to oxygen, that's been mentioned. Such a critical and essential component for safe surgery, but also we saw how important it was in this pandemic. We were able to maximize the production of oxygen plants in country, pivot oxygen training online, and really make an impact and help. Another really exciting thing that we saw through the pandemic was our biomedical technician training. At the start of the pandemic, ICU equipment was needed but it also was being ordered, basically the world supply was being ordered by high income countries. And so we took a look at what was in country, and we're able to partner with our ministry partners, look at the landscape and deploy these biomed technicians to immediately go out and repair the equipment was there, the ventilators, oxygen concentrators, pulse oximeters. So they didn't have to wait for the world supply chain to catch up, but we could make the most of what was already in country. And then another one that John Varala just mentioned was our video conferencing and telementoring. We set up to do safe surgery mentoring, but as soon as the pandemic hit, we immediately shifted the focus, and we were able to connect up clinicians from China and Italy and New York and Spain who were on the front lines to help other colleagues in Tanzania and Ethiopia and Cambodia and beyond to prepare and to be able to know what is the latest daily ever-changing treatment options and learnings and best practices. And so we really saw that how important the investment that we made in safe surgery really made an impact for the whole entire health system and able to pivot. And that extends beyond a global pandemic. It really benefits so many patients when you strengthen a whole healthcare system. So where do we go from here? I think first and foremost, we have to recognize and value partnerships. When you are investing in a horizontal health system strengthening program, collaboration is key. People have different skill sets, organizations. It's so important for everyone to work together. If you read our impact report, we talk about that. We got better as a partnership as we moved forward, valuing each other, building that trust, but also within with our funders and with our getting more on board and needing more, and certainly with our colleagues in Tanzania, Ethiopia, Cambodia. So essential for us to partner with them. It's very important. The other really important thing is to address the system gaps. Like we said, we need to invest in staff, space, and systems. It would be so wonderful if we could move into this next decade with a coalition of funders who would really see the value and invest in national surgical obstetric anesthesia plan implementation. These countries that are building out these plans, which are essential, need investment now, and they need more than just the GE Foundation and some of the other funders who we're so grateful for, who have been stepping up to the plate, but really need a strong investment to make a difference. And then from our local governments, I think that leveraging local champions is key to drive change, and we have to value that, and we have to look for that, and we found that in our partners in Cambodia, Ethiopia, and Tanzania, and looking for that beyond. I think it's important for local governments to develop national surgical plans. That way partners can look at where do we fit in, where's the skill set, where's the gaps that this country has, because it's going to look different in each country that you're in. And then we need to invest and build for sustainability and scalability. It's very, very important. One of the things that I often say about safe surgery is we're not looking for a cure because we already know what to do. What we need is we need the will to invest and do the hard work together so that we can make safe surgery available to everyone. Thank you.
Thank you, Sherry. I love that last line. It's that idea of we know what to do. It's just a matter of making the time to do it, making the commitment to do it, and investing in doing it. So thank you for those comments. Look, everyone, it's top of the hour, and I want to be respectful of everybody's time. I wish we had time for more discussion, more questions, but let me just say this. As we conclude today, I want to first of all thank each of our panelists and all of our partners in the Safe Surgery 2020 program. You truly inspired and encouraged each other to make this successful, and you actually inspired me to really work with all of you to make this the type of program it was and the type of program that I hope it continues to be. The success of Safe Surgery 2020 and the future of safe surgery overall has been truly empowered and will continue to be empowered by your trust of each other and your collaboration. It was amazing to watch and truly gratifying to see the outcome of this and the results. I also want to thank everyone in the audience for attending today and listening to more about Safe Surgery 2020 and the initiative and hearing about what lies ahead. And I want to invite you to continue the discussion and to get involved. You'll see on the screen here how you can contact us, either via email or on social media and Twitter and LinkedIn. There's still a lot of work to be done to advance global surgery. And I hope that together we will continue to make a difference in this effort to reach our goal, which is access to safe, affordable surgical care for everybody around the planet. So with that, I want to thank you all again. I wish you all great health and safety. Please feel free to reach out and continue this discussion, and please get involved. We've just started this. We need to continue this work and continue this fight for access to surgery for everyone. So with that, thank you again, and everyone be safe and healthy.
Thank you so much, David. And yeah, thank you, everyone. Obviously, time flies when you're in good company. So please do reach out on one of these channels here, or the easiest way is just to Google Safe Surgery 2020. We do have the market space for that, so you will find us and then get in touch, and we'll try and direct questions and inputs and comments. It's been great. Thank you so much, guys.
Thank you.
Thank you.
Bye, everyone.
Bye.